Hi guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast I call the Common Sense MD. Today's a follow-up of last week's podcast about sleep apnea. And this is a very, very important subject. And today I want to talk about how to obtain a home sleep test. Last week I talked about how devastating the health consequences can be of sleep apnea, not to mention how tired it makes you feel during the day, but it really leads to a lot of cardiovascular problems down the road. And remember, it's not just overweight people or people with big, thick necks that it happens to. It happened to me, so I have sleep apnea myself. I think as you get older, your upper airways become more lax, and it's much more common, very underdiagnosed. I'll talk about the statistics last week of this, so go and look at that. But, and I can tell you personally, I feel way better having it treated. I mean, way better. Everything looks better on all my parameters, on my Oura Ring and my sleep profile, everything. So the first thing is diagnosing sleep apnea. I have a questionnaire for patients that I'll try to download for you that'll help you and your husband or wife or sleeping partner, family that may notice you're tired all the time, you fall asleep watching TV during the day, you get up and you're still tired. So look at that questionnaire. Now, I'm going to talk about home sleep test, which I had. Make no mistake, the sleep lab test, the formal sleep lab, is the gold standard, but there's a lot of disadvantages to doing this too. Personally, I didn't want to go sleep in a strange place with all the attachments all over your body while somebody observes your sleep for one or probably 2 nights. Plus, in this area, it takes about 4 to 5 months and a lot of hassles to even get a sleep study in a formal sleep lab. We have them, and they're good, but there's a lot of hassle to it. Believe me, I watched my own physician brother go through that process, and it took a long time he got excellent care, but it took a long time to get the test and then to get treated for it. But he did get excellent care, and actually he's the one that kind of pointed out to me that I may have it. But anyway, he's always saying I take the easy way out, and I do in a lot of cases. So I took the easy way out, and I got the same results as he did. A lot of the hassle really with a formal sleep lab is with insurance companies. Of course, they throw a wrench into everything. I'm not fond of insurance companies except for disasters, you know. You need it, but it's not that great for routine things. The average 2-night sleep study at a sleep center costs around $7,000. Of course, they're going to file your insurance, but whoever can figure out what in the end your insurance is going to pay is a genius. Anyway, nowadays with all this new technology, there are great home tests that are accurate. And you don't have to wear nasal prongs, chest bands, electrodes on your head like the first generation of these. And a lot of them simply measured your O2 sats at night through a little finger thing. So we've got a new generation of these tests that I really like a lot better. So the one I really have come up with is called a sleep image ring that fits on your thumb, and it's just more accurate than the old ones. It's FDA cleared, even for pediatrics, and it measures for both obstructive and central sleep apnea. So in addition to oxygen levels at night, it measures sleep quality and duration, sleep fragmentation, heart rate variability, periodicity, meaning breathing patterns and periodic leg movements that are pretty common, all by wearing this thumb ring for 2 nights. Plus, the company that does this does not sell CPAP machines, so they're really not biased, and I've found I get a very accurate measurement. You know, I even have some negatives. You know, it seems like when I send somebody to a formalized sleep lab, I have very few negatives, but they always are setting you up with a CPAP, which usually is appropriate, but it makes you wonder sometimes about the payment system of these sleep centers. I'm not trashing them because they're good, but in my mind, if you can have just a better way of doing it, easier for you, way cheaper, way faster, you should do it. Unless you're one of those cases where it's really very equivocal, you may have central sleep apnea, although this diagnoses it, I would get another test on top of that. But you may have things like heart failure, you may have narcolepsy, those things. So there's definitely a place for a formal sleep lab. But anyway, with the sleep ring that I'm talking about, they also file your insurance, but they have a cash price of $339. And for those who can't afford it, that meet criteria, it's $249. When we order these, it usually comes to your house within 5 days, and we get the results back in a week or two. If positive, we review the results with you and decide on a course of therapy, usually CPAP. There's some other options, but that's usually kind of the start place and the gold standard right now. We'll write an order for you to visit your local medical supply company that does, like Respicare, that does have experts in using these CPAP machines. They can fit you with them. And now they use auto titration. So that's a really good thing to do. So in other words, you don't have to go back to a sleep lab and spend half the night diagnosing your sleep apnea, then the next half of the night titrating it to the pressures that will be enough to open your upper airway. So it auto titrates. So it's real easy. I did it, and I didn't even feel the titration, but it worked really well. I'm really happy with mine. So again, the formal sleep lab is still the gold standard, especially for these difficult diagnoses. But for my money and taking the easy way out, I like the home studies for most of my patients. And you wonder, with all the technological advances, will the sleep labs even go away? I mean, I think they probably will, because there's an easier, just as good a way to do it for most people. A lot faster, way cheaper. So I think way more people are willing to do a home sleep test, and they're making it real easy to begin your therapy. Believe me, it makes a huge difference in how you feel and prevents a lot of cardiopulmonary problems, as well as some probably neurologic problems down the line. A whole host of other medical complications can take place as you age if you have sleep apnea. As you know, in my practice, I stress 4 major things to stay healthy: nutrition, exercise, hormone balance, stress, and sleep management. Sleep's a big one. You have to sleep well to maintain your health. There's no doubt about it. There's no doubt about it. So think about, if you or someone that you know may have sleep apnea, take the questionnaire. And now we have an easy, great way to diagnose it and treat it. Plus, we found a great, reliable outside coordinator for this. So he makes it real easy for all our offices to really coordinate this in a seamless fashion. So think about sleep apnea. Think about maybe getting an easy home sleep test to look and see how severe it is. I hope this helps. I'll see you next week.